Medics and researchers are raising alarm over advanced HIV disease that occurs in people living with HIV that is not managed. According to the National Empowerment Network of people living with HIV/AIDS, the number of AIDS-related deaths have been confused with non-communicable diseases. Emily Chebet reports.
The fight against HIV and AIDS in the country has seen big milestones in the last few years. But the efforts are facing challenges, with some people living with HIV presenting themselves to hospital late for testing, while others are stopping medication due to factors like medication fatigue and stigma.
We currently see trends that we were seeing a long time ago coming back. The fact that we have treatment which is free, the fact that we have testing which is free, we are seeing people who are not taking up that testing for HIV, delaying that testing and testing when it is very late, particularly men. We are also seeing people who, after testing and they find they're HIV positive, they are not taking medication.
2022, as per our estimates, we had 18,473 people who died because of AIDS-related mortalities. So these are people who died because of things like TB, infections, malnutrition amongst children, diarrhea disease, and we think that these are actually preventable deaths.
According to the World Health Organization, all children under the age of 5 years are considered to have advanced HIV disease due to their immature immunity. Medics are calling on the healthcare facilities across the country to find out the status of any person admitted, as some fail to disclose and end up defaulting on drugs while in hospitals.
One of the key things we have seen that is contributing is late diagnosis. So some people are taking too long to know their status, and by the time they're getting to be tested and know that they're actually living with the virus, then the immunity has already declined, and they're coming in when they're already at risk of all these infections and even death. Particularly, we have seen the challenge of late diagnosis, specifically in men, that we still have not been able to reach a target of identifying 95% of the men who are actually living with HIV.
According to the Ministry of Health, TB is still the leading cause of death among people living with HIV. The infection rate of TB among this community of people is at 5%. Emily Chebet, Citizen TV.